In this video, I'm going to be talking about the 7 most common signs and symptoms of sickle cell disease. Hello, I am the Love Queen Joy and welcome to my channel. Now, people ask me, Joy, does sickle cell disease have any signs and symptoms you can share with us? Yes, it does. And I'm going to share with you the 7 most common signs and symptoms as well. Well, I have to make a note, however, with this video that all of these signs and symptoms may not manifest in one person or in one sickler. However, I have seen sicklers who manifest all of them. I have seen sicklers who manifest just maybe 3 or 4 or 5 of them. And then I have only known of one so far, very little number of sicklers that don't actually show any of these signs and symptoms and were diagnosed, well, it's a long story, through a blood check. Be sure to watch this video up to the end because I'll be sharing the number 1 mistake done by people in regards to sickle cell disease. If you're finding importance in this video so far, you can just give it a thumbs up. That will really be awesome. Thank you. Now let's jump into the main goal of this video. Sign number 1 is what we call the hand-foot syndrome, or what you can call the swelling of the hands and the feet. This is caused by clogging of blood vessels, especially small blood vessels that supply the hands and the feet with blood. When they clog the supply, the move of materials, the move of fluids, the move of everything to these hands and feet is really limited, brings about swelling. And this is one of the earliest signs, especially in infants, that can be a red flag to inform you that this person might be having sickle cell disease. Number 2 is anemia. Remember, in my previous video I talked about the red blood cells, the normal red blood cells having a lifespan of up to 121 days, and sickled red blood cells having a lifespan of up to 20 days. Yeah, so this breakage or this hemolysis, or this, in simple terms calling it death of red blood cells, causes a shortage in the amounts of red blood cells. And once that happens, well, that qualifies to be anemia, and that is why sickle cell disease is also known as sickle cell anemia. Now, anemia also brings quite a huge sum of fatigue. Now that brings us to sign or symptom number 3, which we call jaundice. Jaundice is a yellowing of the white of the eye and the skin. I don't know whether you can see mine, they are somehow yellow. So this comes about when there is too much breakage of red blood cells. That is how it manifests on the eyes and also the skin. However, so when this happens, you have to also rule out not just hepatitis B, not just yellow fever, not just liver issues, but also sickle cell disease. Number 4 is episodes of painful crises. Now, we talked about a crisis in my previous video, look out for it. We talked about what a crisis is and how it comes about. Now, when a person keeps having these pains, you also have to put into your mind and ask yourself, what about sickle cell? Maybe it is high time you do that sickle cell test. Now, this painful crises can really, their intensity, well, they can last for maybe a few hours, sometimes up to days, up to weeks. And then there is also what we call chronic pain. Chronic pain usually is a result of a sickler having damaged bones or damaged joints. Or like, for example, me, I have a damaged hip, and this really is constantly painful. Some sicklers have ulcerations on their skins, and this really brings about constant pain, which we are calling chronic. For some sicklers, they can have these painful crises maybe 1 to 2 times a year, others more than that, and then others really none a year. There's a time I spent some couple of years without a crisis, but man, of recent they just got me. Yeah, this is why the volume is not very okay. I'm really struggling with energy and all. I've been quite sick. Yeah, so pray with me to get out of this situation. Our fifth sign is the frequent infections. Now, like I explained before, when the clogging happens, it depends on where it is happening. Now, when the clogging happens, the blood vessels that majorly supply the spleen, you find that the spleen is damaged. And when the spleen is damaged, this makes you vulnerable to quite a lot of infections. That is why some parents really complain, sicklers get sick a lot. They always have these infections. Yeah, because in most cases it is attributed to our spleens. So you are really vulnerable to getting a lot of bacterial infections, parasitic infections, viral infections, all these kinds of infections. And be sure to look out for my upcoming video where I'll be talking about how to really control these infections in a sickler. Our number 6 is delayed growth. Now, because every nutrient that we basically need travels in blood, and the more these blood vessels get clogged and the more these red cells die, these body parts cannot get sufficient nutrients for their growth and sufficient oxygen for their growth. So what happens is there is slowed growth, especially in infants, in teenagers, or in adolescents. You'll find that they have this delayed puberty because of these effects. Yeah, so was your child showing any of these signs and symptoms? Can you please put sickle cell disease on the list of diseases to be checked for? And then my last and 7th sign is really vision damage. I will not stop repeating this. The clogging here happens in the blood vessels that supply the eye, and now once that happens, it means the eye will be affected, the retina will be affected, and once the retina is not getting the sufficient oxygen and nutrients it requires, this may really lead to vision problems. So earlier in the video I mentioned that I'll be sharing with you the number 1 mistake that people do regarding to sickle cell. Now, before I go any further, if you haven't subscribed to this channel, please do. Please like, and most importantly, please share. We need to share this content. We need to share this as much as we can. The number 1 mistake done by people in regards to sickle cell is stigma in form of pity. Parents, teachers, people of the community pity sicklers too much, and they deny them an education, all in the name of, oh, they are too sick to go to school. Employers deny sicklers chance to work because, oh, they are too sick to work. My appeal to whoever is watching this and wherever you're watching it from is support the sicklers in your circle, love them, cherish them, find something they are good at and support them. Do not pity them. Find good in sicklers, and in the comment section below let me know if you know of anyone in your circle, a neighbor, a relative, a friend, a workmate, anybody you know that has sickle cell disease, and how you think you can support them. It can just be talking to them and encouraging them. Help me help sicklers around the world. I cannot do this alone. I need you to help me. Subscribe, and most importantly share. Leave me a comment of what you think and reach out to me and my email address. See you another time. Bye.